without surgery. Prior to your surgery, there will be some things that you will need to have done. One of those things being your lab work. So when we have you have your labs done, we are checking to make sure that you don't have any active infection, to make sure that your blood coagulates like it's supposed to, make sure that you are not pregnant going into your surgery. For patients over the age of 50, we always do an EKG to check their heart just to make sure that there's nothing going on that we need to be concerned of prior to your surgery. And also a chest x-ray depends on the patient, and to let us know if there's anything going on as well that we need to be aware of prior to your surgery. Walk in, give them the lab slip, they'll ask you for your insurance card, give them your insurance card, and that's it. So starting a couple of weeks prior to your surgery, there are some things that you will start doing in preparation for your surgery. Another one of those steps is getting your medications. There are certain medications that we will give you. One of those will be for pain. One will be for a muscle relaxer. Anytime that we have any surgery done in our chest area, our chest muscles and our back muscles like to tense up and make recovery for us a lot more difficult and painful. So we also give you a muscle relaxer just to help those muscles relax so recovery can be a lot more easy for you. Another medication that we will give you is an antibiotic, and that is to help prevent any post-operative infection. Another step that you will take prior to your surgery is preparation of your skin. That is important because naturally we have little bugs on our skin that are helpful until we open the skin. Those little bugs like to get in there, stir things up, and can potentially cause an infection in your incisions post-operatively. So starting 3 days prior to your surgery, you will start washing with Hibiclens just in the area where we will be working. So basically from chin to your belly button, all the way around circumference into your armpits and down to your elbow. And what that does is that just helps cut down that microbial count prior to your surgery to help prevent any post-operative infections. Another step that you will need to take prior to your surgery is to go get a good supportive bra. This bra needs to button or zip from the front, and it needs to have no underwire. We want you to restrain from stretching or reaching in far distances after your surgery, and this will help assist in that. We also would like for you to come dressed in some good comfortable clothing the day of surgery, but your shirt does have to be button up or zip up. That is because we don't want to be pulling anything over your face or having you raise your arms above your head to redress you after your surgery. We ask that you do not eat or drink anything for 12 hours prior to your surgery. So there are a few things that you will need to change starting the day of your surgery once you return home. One of those things being your sleeping position. We ask that you prop yourself up in the back with a couple of pillows to keep yourself propped up. We also ask that you limit your activities and your lifting. Let's talk about that a little bit more specifically. So after your surgery, you will not be able to lift anything heavier than 5 pounds. You will not be able to lift your elbows above your shoulders. We don't want you doing any far reaching up above or back behind you, or even, down below or out in front of you. Nothing to stretch the muscles and the tissue in your breast area. Another thing to anticipate the day of surgery when you go home is the pain. A lot of people feel very good in the first 24 hours. That is because the effects of the anesthesia are still wearing off. The intensity of the pain usually hits around the 3rd day. It is very important that you start the medications as soon as you get home. In order to do that, you need to get something in your stomach. Once you get something in your stomach, you need to consistently and regularly start taking your pain medication, your muscle relaxers, and your antibiotics. For the series of your post-surgical appointments, there are a number of things that we will be going over with you. One of the things that you will need to begin to do is implant manipulation. And that is just a series of pressure that you will apply from the top of the implant to the bottom of the implant, sometimes from side to side, depending on the patient. It is very common that initially after your surgery, your implants will feel and look very high in your chest. There are different techniques that we will go over with you on how to manipulate your implants to get them to move into the position and the pockets that they are supposed to settle into. I know this is a lot of information for anyone to remember all at once. That is why we give you all this information written down in a personalized surgical packet. In that surgical packet also includes myself and Dr. Miles' personal cell phone number. That way, if anything happens or if you think of anything and you have any questions or you need to get a hold of us right away, somebody is always available to answer your needs as soon as possible.